Colon cancer, often referred to as the silent killer, is a condition that creeps up quietly, often showing no signs until it's already advanced. With over 100,000 new cases diagnosed every year in the United States alone, it is one of the most common cancers, affecting both men and women. Tragically, it claims nearly 50,000 lives annually. The good news? If detected early, colon cancer is one of the most treatable types of cancer, with survival rates skyrocketing to 95% in the early stages. In today's video, we're diving into the 9 early signs of colon cancer that you simply cannot afford to ignore. Some of these symptoms may be subtle, others more obvious, but recognizing them early could save your life. 1. Changes in bowel habits. Have you noticed anything unusual about your bathroom routine lately? Your colon plays a critical role in your digestive system, and its health often reflects in your bowel habits. Normally, people have regular bowel movements every day or two, with stools that are soft, brown, and easy to pass. If you suddenly find yourself struggling with constipation, going to the bathroom less frequently, or if your stool has become hard and difficult to pass, it might be more than just a dietary issue. Pay attention to unusual changes in frequency or consistency, as these could signal a deeper problem brewing in your colon. 2. Diarrhea that won't go away. On the flip side, persistent diarrhea can also be an early warning sign of colon cancer. Diarrhea refers to passing 3 or more loose stools within a 24-hour period. While it's often caused by infections, food intolerances, or even stress, chronic diarrhea can indicate a problem within the colon. Cancerous tumors may cause inflammation or blockages in the digestive system, leading to prolonged bouts of diarrhea. If you're experiencing loose stools for more than a few days without a clear cause, don't ignore it. Consult your doctor. 3. Constipation. It's no secret that constipation is uncomfortable and frustrating. But did you know it could also be a red flag for colon cancer? The colon is responsible for absorbing water and nutrients and eliminating waste. When its normal functioning is disrupted, possibly due to a tumor, you may experience constipation. Here's an alarming statistic. More than 80% of people diagnosed with colon cancer reported dealing with constipation before their diagnosis. If your constipation lasts longer than 3 days or is accompanied by other symptoms like blood in your stool or abdominal pain, it's time to seek medical advice. Blood in your stool. This is one symptom that you absolutely cannot afford to ignore. Seeing blood in your stool can be terrifying, and while it isn't always caused by cancer, it's a serious enough symptom to warrant immediate attention. Blood in the stool can result from a variety of conditions, including hemorrhoids, ulcers, or inflammatory diseases. However, it's also a common sign of colon cancer, especially if the bleeding is persistent. Don't try to self-diagnose. Talk to your doctor to find out what's going on. Early detection could be the difference between life and death. Rectal bleeding. Bleeding from the rectum is another symptom that many people experience but often dismiss as hemorrhoids. While rectal bleeding can be caused by less serious conditions like anal fissures, it may also be a sign of colon cancer. Remember, the rectum is the last stop in your large intestine before waste exits the body. If you're experiencing recurrent or unexplained rectal bleeding, don't take any chances. Get it checked out right away. Unexplained bloating or abdominal pain. Do you often feel bloated, full, or experience abdominal discomfort without any clear reason? Bloating might seem harmless. It happens to everyone occasionally, especially after a large meal. However, persistent bloating or abdominal pain could signal an underlying issue in your digestive system. Colon cancer, especially in its early stages, can cause these symptoms as tumors grow and disrupt the normal flow of digestion. Other risk factors, like poor diet, smoking, and genetics, may further increase your chances. If bloating is frequent and unexplained, it's worth investigating further. Constant fatigue. Feeling tired is something we all experience, especially after a long day or a sleepless night. But what if the fatigue doesn't go away, no matter how much rest you get? Persistent fatigue can be a sign that something is wrong in your body. When colon cancer develops, it can cause internal bleeding, leading to anemia, a condition where your body lacks enough healthy red blood cells to carry oxygen. This can leave you feeling drained and weak. If this sounds familiar and is paired with other symptoms on this list, it's time to take action. Sudden weight loss. Have you recently lost a significant amount of weight without trying? While shedding a few pounds might seem like a blessing, unintentional weight loss can be a red flag for serious health issues, including colon cancer. Cancer affects how your body processes nutrients, often leading to unexplained weight loss. If you've lost more than 10 to 15 pounds over a few months without changing your diet or exercise routine, consult your doctor to rule out potential causes. Do you often feel full or bloated, even when you haven't eaten much, or at all? This constant feeling of fullness can be a sign that something isn't right in your digestive system. Tumors in the colon can create blockages or disrupt the normal digestive process, leaving you feeling uncomfortable and unable to eat normally. If this sensation is coupled with other symptoms like fatigue or weight loss, it's a warning sign that should not be ignored. While these symptoms are important to watch for, it's also crucial to understand your risk factors. Colon cancer is more common in people over 60, but younger individuals are not immune. Genetics play a role too. If a parent, sibling, or child has been diagnosed with colorectal cancer, your risk increases significantly. Lifestyle factors like poor diet, lack of exercise, smoking, and excessive alcohol use also contribute. Even race can play a part, with African Americans facing higher risks than other ethnic groups, partly due to disparities in access to early screening. The good news is that colon cancer is highly preventable. Maintaining a healthy diet rich in fiber, staying physically active, and avoiding smoking and alcohol can significantly reduce your risk. Regular screening, especially colonoscopies, is a game changer for catching the disease early, often before symptoms even appear. If you or someone you know is experiencing any of the symptoms we've discussed today, don't wait. Consult a healthcare professional. Remember, early detection saves lives. Stay informed, stay healthy, and take action when necessary. If you found this video helpful, don't forget to like, share, and subscribe for more content designed to keep you and your loved ones well.